What is up, you guys? This video is gonna be really fun. Although, I don't know, I can't believe it's even here. I really can't. Like, I know that it happened, and I know time has gone by since it happened, and that's an update, and that's why there's this update, but like, it's so crazy because it's almost like I feel like it didn't happen. I was sitting in my surgeon's office right after he, looked at my chest and things like that, and he was saying all these things, and just saying like, you can't hurt it anymore, pretty much, because you're past that mark when you would, and like it's all healed up and whatever. And I think that's when it hit me. I think that's when it finally hit me, a month post-op, that I had top surgery, that it was done. It had already happened. Not the day in the hospital after having my surgery, looking down, seeing the ace bandage, not when they unwrapped me that same day and I looked down, not when I got my nipple pads off, not when I got my drains out. None of that. A month post-op, it's like I finally understood that I had gotten top surgery. I don't know, I was just so focused on recovery, I guess. I guess I was just worried about all of these other things, and I was just preoccupied, really. Sitting in that room with nothing on my chest. No gauze pads on my nipples, no tape or anything, no ace bandage, obviously. No drains, obviously. Nothing. And just sitting with my chest and looking down, just taking my shirt out and just looking down at my chest. It's like I finally understood that it had happened. Like, it's still weird. It's still weird to think about. It's just something that changed so quickly. Except my mind kind of eased into it. I kind of dealt with it well. That's good. Yeah, like, my mind kind of gave itself a chance to, like, ease into this big change. So that's good. It's really good, actually. It's pretty healthy. And there are so many... Okay, I really want to address this. There are so many videos online with everybody looking so happy and elated and everything the day after their surgery, or the week after, whatever, on their post-op. Like a week after, usually. And it's like, you see their faces and they're so happy. But, I don't know. And, I mean, that's absolutely amazing. But I don't know if they, like, look like that all the time, you know? When they think about their surgery and everything, but then they have to go back, you know, to their real lives and go through the motions still. For me, I'm just relieved. You know, it's not extreme elation or, you know, euphoria or whatever. It's just, I'm relieved that I don't have to bind anymore. And I'm relieved that I don't have to worry about my ribs caving in on each other. I was starting to get bruising from binding, and I don't bruise easily at all. And I can finally think about singing again, because I can actually breathe. And I'm probably gonna go to the beach later on this month and take my shirt off and swim. And it's just... I'm so happy because I can do all of these things, but when I think about it, I'm just relieved that I can do all these things that I should have been able to do before. You know, and it's just that thought of, like, I should have been able to do this before, and I knew that while I was binding, and that's what made it so hard. But now, it's just, I don't have to go through that pain. The, you know, physical, very, very real pain of not being able to breathe because you have a binder on, even if it's a size too big for you. And, you know, and also, obviously, very deep emotional pain of, I have to I have to do this in order to feel okay with my body out in public. Or sometimes not. Sometimes I would bind at my house because I felt like I had to. I don't feel that anymore. And that's amazing. That's amazing. I feel like I feel that extreme happiness and everything, and you know, the euphoria upon reflection of what happened. Getting surgery and all of that. I feel all of that when I reflect back on it. You know, does that make sense? But I don't feel it in everyday life of just existing with this chest, with this, just the way I always thought it should be. It's kind of weird. I don't know. But I've said what I wanted to say on that, and we all know what you're really here for, so let's get into that. I know what your intentions are. So, this is my chest. Also, this is a temporary tattoo. I got it from the Philly Trans Health Conference. Oh yeah, that was really fun. I might make a video on that, I'm not sure. It happened like 2 weeks ago, I think. So, anyway. My incision starts here. Also, this was the drain hole. It really doesn't look like much. I think that's gonna... It just looks like a scab, honestly. That's definitely gonna go away soon. So, my incisions are pretty red. I mean, granted, I'm only a month post-op, and then it goes this way. There's my drain hole down there. It's pretty low, actually, which is nice. It's nice that it's not, like, right at my armpit, so I don't have to, like... You know, I think they did that for a reason. So, and then, this is on my kitchen counter, so it's kind of hard to show. But, my nipping up. This is my right nipple. And the other nipping up. This is my left nipple. You know how people say that they have good nipples and bad nipples? I think both of my nips are good and not as good for different reasons. So this one pokes out a lot more, and this one's very flat. I keep going like this, like it's scandalous to be showing my chest or whatever. And it's like, this is just something I have to get used to. It's like, I'm gonna be like this on the beach, like, oh yeah. I really like the way this tattoo looks, by the way. It's a temporary tattoo, but I might get a tattoo there, and then I'll get one here. Anyway. So, yes. I do have a little bit of dog ears, and, like, I think it's mostly because my incisions go really far back, which, I mean, I'm kind of okay with. I got, like, them rolls, so that's beautiful, but, and also, there's a little bit of tissue that's still hard here, which is interesting. I don't know if he, like, left some tissue, or sometimes it just gets, like, solid down there for some reason. I think, well, he said to put like scar strips and things like that on there, and that should, for the most part, go away. He wants to see me back after, he wants to see me back in February, and it's September, so in like 5 months. Also, I have another post-op with my other surgeon, so that's in a few months. I've got this nice, not cleavage, but like, I've got this nice line down the middle. I like it. And I do like my scars. Like, the contour, I think, is really good. And they're not exactly even. Like, this one comes up a little farther. This one isn't quite as long, I think. But I'm perfectly fine with that. He did warn me. He did tell me, like, the risk with anything like this is asymmetry, and like that's fine with me. I don't have to have them both perfectly symmetrical. I've got some residue of the tape because he was like, well, you can use just paper tape on your nipple or on your incisions, and that should get them to heal up pretty well. But then he recommended the silicone stuff, so yeah, he recommended like silicone scar strips. And so I'm just gonna order those on Amazon. I did use Mederma here, and then I asked him about it, and he was like, there's not really any evidence showing that that works. And I'm like, alright. But, yeah, so I'm just gonna use what he recommended, and then if I feel like I need to get Mederma, again, because I'm pretty much out of it, I will. So, yeah. So, there's, the, incisions are a little bit, like, bunchy over here, and he talked about that. That's supposed to kind of go away, but also, like, the scar strips and stuff like that, it's supposed to help with that. To be honest with you, I don't really, like, he's a plastic surgeon, so he's all about the details and stuff like that. To be honest, I don't really notice it that much. And, like, if they go away, that's cool. If, like, if it doesn't, then I feel like I'm gonna be okay with that, too. Honestly, I'm just so happy with, I'm really happy with the result. I really, really am. And, I mean, further down the line, in about a year, I might get a revision. I might not. Who knows? But I think it looks really good. Just a couple of things, like the nipple. This part of it is a little, like, you can't even really see it. It's just this one part where it's a little bit, like, this part is light. This one part right here. I don't know, you probably can't even see it. It's just some, like, nitpicky little aesthetic things, but really, I don't even notice it. You know, I have a shirt on, and I'm not thinking about my chest, you know? I'm not thinking about any of that. I'm just thinking of the fact that my shirt can touch my chest when I have it on, and I don't have any kind of barrier in between that. That is what I wanted. It really is. I love my chest. So enough about that. Sensation. I have full sensation up here. I have kind of a numb sensation right here. It's like pretty much full sensation right here and all of that. Over here, kind of the same, it's a little numb right here and then right here. On my nipples, they're actually getting sensation back very quickly. Where I had very numb sensation on my nipples themselves a couple of weeks ago, now it's like, it's a lot more. And it's like fireworks now, you know, in comparison, because it's just like, whoa, it's a lot different. I think I will regain nipple sensation. Like, maybe not fully, but it's hard to say. It really is, because I'm only a month post-op. Under here, I have, like, full sensation. A lot of people say that they have not a lot of sensation on their incisions, but that's, like, where I had sensation the first even week. Like, I really felt it. It's very tender, though. Like, if I go like this, like, it's like, ugh! My nerves are firing at an increased rate. It's like, what are you doing to me? We're fresh. What are you doing? Like, I'm just rambling on at this point. Yeah, that's it. My armpits are hairy, and I got nips. That is the takeaway from this video, obviously. I have hairy armpits, and I have nipples, so there you go. Alright, thank you guys so much for watching. I will have another update, maybe in a month. Yeah, that makes sense. And I'll talk to you soon. Okay, bye.